Hey everyone, this is a special episode of Balls Deep because I have a confession. I have been taking a certain pill that is intended for sexual dysfunction for the last 6 months. But more importantly than what it is why I'm taking it. And I'm really excited to unpack a bunch of the health benefits and why I'm being proactive about my health instead of reactive. Balls Deep. Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in.
So this is going to be some drama on the podcast today. And so talking about this big shift, you are taking something that I'm not sure what it is to be more proactive about your health as opposed to reactive.
Yes. Too often in healthcare, we just treat illness, right? We have
True.
a problem and we treat it.
True.
And we're seeing this shift with all this longevity talk and all these cold plunges and saunas and different medications and ways to think about creating health proactively. And sometimes that does involve selective use of actual medications. And so we'll go into that a little bit more later. But, what's special about this medication is it's what's called a vasodilator. So a fancy doctor term for dilating blood vessels. And so we want to get good blood flow to different areas. So this can help our cardiovascular health.
Okay.
It can help our urological health. Okay. And it may even help our brain health. So for all these reasons, I was pretty excited to try it and happy to share my experience.
Okay, so I'm intrigued. Tell us more. So how is this working on your body?
Most interesting thing was the help in my urine symptoms. I'm getting a little bit older. I'm having trouble saying words even.
Okay.
And, I was starting to just get some, dribbling, starting to wake up a little bit at night. And we all know how much I love my sleep and how important that is.
You do.
But a lot of the traditional prostate medications have side effects that I didn't like.
Okay.
And I want to see if there's something that had some added benefits. So because this medication dilates not only blood vessels, but relaxes smooth muscle, and the prostate and the bladder opening are smooth muscle, I've had almost a complete resolution of my urine symptoms.
Really?
Well, you should notice because you'd always be like, what's that wet stuff on the floor of the toilet?
Okay, I did say that. Like, why? What's happening on the floor here? You're going to need to clean this up. This is a mess.
So, that was obviously something that I noticed as well and listened to your comments, but it was bothering me. And so this medication has really erased all of those symptoms. And so that's really one of the big reasons, but also because it's dilating blood vessels, there's some evidence that potentially this is going to help prevent heart disease, that it's going to help prevent dementia, because, we think of dementia like Alzheimer's, that it's this thing we have no control over, and either we are lucky
it or you don't.
Yeah, you're either lucky or you're unlucky. But a real common cause of dementia is actually, again, that atherosclerosis, the hardening of the arteries, and we get these small vessels that get blocked. And if the brain's not getting regular oxygen, we all know this. I mean, you stop breathing and you can go brain dead within a couple minutes. So imagine you have all these little events happening. This is it's a big cause of dementia that I don't think enough people realize.
So, but this is not a pill for dementia or Alzheimer's specifically, and it's not a pill specifically for prostate issue.
So great question. So it is currently FDA approved for use of urologic conditions, so prostate being one of them. We are starting to see some studies coming out suggesting its benefit in the dementia prevention, the heart attack prevention.
Okay.
Saw a study recently that was pretty exciting. It was a retrospective look of about 500,000 people on this pill versus not. And they showed anywhere from 30 to 40% reductions in things like death, heart attacks, dementia, diabetes, all of these things. Now, anytime you look backwards at studies, there's confounding factors that you've got to kind of unpack, and you try and battle that as someone in the medical studies literature by matching those two cohorts. Well, if I get everyone of the same age and the same weight and the same lifestyle, and the only difference is this medicine, then maybe the medicine's playing a role. So I don't want everyone thinking that this wonder pill we're going to reveal a little bit later can definitively do that. But there's enough interesting data to suggest that.
Okay, this is a pill, so you're taking this every day? Do you take this once a day?
Yeah, this is a daily pill, and we'll get into the taking of it, the sort of the side effects and risk factors. But really it comes down to, I want to live a long, healthy life. And I also don't want to tolerate symptoms that are bothering my quality of life. And so if I could kill two birds with one stone, and we'll get into some other potential benefits, where now I don't have this bothersome waking up at night to go to the bathroom, and it could lower my risk of these diseases with minimal side effects, I'm all in.
So you're trying to get ahead of things. An ounce of prevention is worth a pound of cure. You're trying to get out ahead of things before it becomes a severe medical issue. Is that fair?
Yeah, this goes back to our comment earlier, and let's dive deeper into this idea of proactive healthcare instead of reactive. I mean, we've talked about this on the show before. Why did Pazona MD drop insurance? Because insurance is about sick care. It doesn't want you to be healthy. There's very little that is done to promote health and to create health.
Well, you don't make money off of people who are well.
Sadly, you don't.
Sadly, no.
You need sickness, right?
Okay.
And so, they want a lot of healthy people on insurance plans. And then when they get sick, they want to deny the claims, to be clear.
Ugh, that's another show.
Yeah, a whole other show. But we want to create that health. And, I just turned 48. I'm starting to feel my age a little bit. I'm sure I bitch and moan at home more than you like.
He does a little bit. He does.
And I want to be around for a while, but I want to feel good. And I don't want to be that stubborn ass who just like stoically goes about and doesn't change things. I'm willing to experiment on myself. And, we don't have that data for this pill, but if there's enough suggestion, let's go for it.
Okay. So, I mean, it's sounding, I'm not sure still exactly what we're talking about, but it's sounding like this really is some kind of a wunderkind in a pill. I mean, but everything has risk. I mean, is this FDA approved? What are the risks of taking? What are the side effects of this thing that you're taking?
Yeah, so it's FDA approved for two different urologic conditions, one of which is related to the prostate. I'll save the other one because otherwise I think people will realize what it is.
Okay.
And so everything's got risks and benefits, but people don't realize that sometimes sitting idle also has risks and benefits. And so, we sometimes take this granola, touchy-feely, I don't want to take no pills sort of thing. I want to go all natural. Guess what? Aspirin was found from, natural things. I mean, there's so many medications. Penicillin came from a mold.
I love the phrase living better through chemistry.
Yeah. I mean, now all that being said, you do need to look at the risks and benefits. So
of course.
I have had zero side effects from this medication. Some of the more common ones that can occur, mild back pain, stuffy nose, lightheadedness. I'll be honest, I prescribe this medication a fair amount in my urologic practice, and I'm starting to do more so in the wellness front. And it's pretty rare for guys to have to stop this. Now, if you do take certain medications for bad heart disease, such as nitrates, you can't safely take this medication.
Okay.
But for the most part, most people are pretty darn safe to take this, especially in the way I'm doing it, which is a daily low dose.
A daily low dose. And so you're not seeing for yourself or really in your medical practice, you're not seeing people experience terrible, horrific, scary side effects from this.
No. I mean, you hear those drug ads and they talk about you may get sausage fingers and your ear may fall off. I mean, no.
You may go blind and,
Yeah.
Right.
No, I mean, listen, certainly bad things have been reported with every single medicine in history, and Tylenol is the number one killer of people in this country, but we pop those like it's no tomorrow.
Like it's candy.
No, and here's the other beauty of it is that even if insurance doesn't cover it, I pay $15 a month. I mean, $15 a month to get rid of these symptoms.
So it's cheap. It's not expensive.
and to help potentially live longer and promote blood flow throughout your body, I mean, it's been a no-brainer.
Is this a male pill? I mean, because this sounds like something. Can I get in on this? Why? It's sounding really positive. So, I mean, is this for women or men or?
Well, maybe it's time for the big reveal, Catherine.
I think it is because
Yeah.
I don't know what else to ask. But what is this?
I'm taking Cialis.
Oh, my Lord.
Yeah.
Well, okay. Some things have just become clearer in the moment. I have many things I could say right now, but
Oh, don't worry. I'll put you on the
Cialis.
I'll put you on the spot.
Cialis, well, mystery solved. Okay.
So here's the interesting thing. So most people are like, wait, you're taking an erectile dysfunction pill. What are you not telling us, Dr. P? In all transparency, and I've got someone who can call me out on this, and I'll allow her to do so in front of all of you.
I'm here. Okay.
I do not have erectile dysfunction.
He does not.
However, because of the benefits for the prostate, because of the benefits for longevity, and now here's the real reason all you guys are going to want to take this, even if you don't have ED. There is some data in animal studies and beyond that it may help preserve erectile function. So let's, again, be proactive.
Proactive.
Let's not wait to be the 50% of men by age 50 who are going to have ED. If I can take a pill today that is safe, inexpensive, well tolerated, and it's going to potentially, we don't have definitive data today, let me be clear, but potentially lower my risk of erectile dysfunction, which guy's not going to take that?
I think that's going to be 100%.
Right. And I will say anecdotally, and I won't put you on the spot, I noticed a positive difference down there. And again, as a guy who wasn't complaining, nor with a partner who we have a very open relationship and we talk about a lot of intimate things.
Is that down there on you or down there on me? Wait, where's this headed?
But point being, I definitely noticed a difference, that this medication definitely, gave a little extra oomph. That's tapered off a little bit, again, because I didn't really have a problem. But no doubt that I'd say, in my 40s, I've noticed the morning wood hadn't been as often. Listen, this is guys.
Are you saying this?
This is guy stuff.
Wow.
Just hold off for a
This is
second.
guy stuff. I'm not talking.
Guys, you know what I'm talking about. So the morning wood went down a little bit, the nighttime erections. Again, no major complaints or problems, but I'm not like I'm 18 again, walking around like, oh, I got to go up to the chalkboard and like push this thing down. That did happen in high school.
What?
But I'm definitely noticing more spontaneous erections. I'd say it's easier to get them, and it definitely feels fuller. And I'd say for me, sex is more enjoyable. Again, subtle, not the main reason that I did it. And I don't want to make promises to guys that this is going to be your wonder drug. I was very intentional with why I was taking this. This is how it's reacted in my body. And again, I'm very proactive about my health. I eat clean. I do all these things and to maintain blood flow naturally, but it really has been a game changer, and I can't recommend it highly enough. And I'm starting to share my experience in the office with guys. And that's why I want to do this episode, is to be vulnerable and say, I'm on Cialis and it's okay. And I don't have erectile dysfunction. And if you do, that's okay. It's not a judgment issue. For me, it was the right choice. And I think these are interesting enough things to consider that I'm starting to prescribe it more for guys who want to be proactive like myself.
Okay. Well, I, again, really did not know this. So
well,
things you learn on the old podcast.
Well, Catherine, I did enough talking. What are your thoughts on this?
I don't know that I should share all of my thoughts. That kind of explains some things recently. Then.
All right.
You certainly seem interested.
Well, I'm always interested, but
you seem more interested. I'm going to leave it there.
There's maybe more of a barometer to show my interest.
Very interested.
Well, Stream Team, maybe this is a good place to end this episode before my wife turns any redder in her complexion.
I'm headed to purple.
Yeah. But what are your thoughts? Would you take Cialis after what I just told you? I'd love to hear your thoughts. Have we convinced you enough? What are your concerns about the medication? Please drop them in, and I would love to be able to answer those for you. So And before you sign off, hit that little subscribe button so you can tune into future episodes and have more fun with us here on Balls Deep. So, Kat, thanks as always.
Yeah. Wow.
She was a trooper, guys.
I was a trooper.
Stream team, please show yourself a little bit more love and kindness. We're all works in progress. These are opportunities to grow. Thanks. Have an awesome day.
No pun intended.
And take Cialis.
Cialis.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.